topic was called, or it was entitled, "A Pain in the Back," and it was to look at back pain or spinal pain from a broad perspective, to see what are the types of tissue structures that can lead to someone presenting with back pain, looking how it may present in terms of the symptoms and the clinical signs that the doctors elicit, and in particular looking at what are the symptoms and signs that may warrant more urgent attention or investigation and referral to someone such as a spinal or a neurosurgeon. That was one aspect of the presentation. We also then looked at, once we've made a diagnosis, how then can we manage it, and we looked at conservative types of approaches, multifaceted approaches, which may involve pharmacotherapy, physiotherapy, acupuncture, and spinal injections, and then the more active approaches, which are the surgical approaches. And I had an opportunity to share with the audience a number of cases in a very interactive way with them. So the three take-home messages from that talk, the first one was how to recognize the clinical red flags, and those are the things that might prompt further investigation and early referral, particularly in the setting of if there was a motor deficit developing or fixed sensory deficits. And we talked about radiculopathy, myelopathy, and cauda equina syndrome. And so identifying the serious aspects of those symptoms and signs in those various presentations was one take-home message. The other message really was that surgery is an undertaking that should be carefully considered in terms of careful selection of patients, and then the appropriate types of surgical treatments undertaken, whether they be the basic or simple types of surgical or more advanced reconstructive ones. And the final take-home message was that there are some really exciting options now, because technologies have advanced to a point where we can use artificial discs, neuro-navigated screws, which are like GPS navigated screws, and the introduction of robotics now in spinal surgery. Emerging developments in the field of spinal surgery are really related to enhancing safety and accuracy, and so navigation technologies, using minimally invasive approaches that disrupt the natural tissues as little as possible, and now the field of robotics, which is assisting in the placement of those types of instruments that we use, the screws in particular. I think also now we've come to the point where we have the latest generation in artificial discs, which actually preserve flexibility in the neck, and are more like the natural physiological kinds of tissues that we have. So these are I think the key exciting developments that are here and are being further refined.